Hi everyone, and welcome to the first webinar in our Food Day Leadership Series. We're very excited that you could join us today. This webinar is Policy Advocacy 101, Make Your Voice Heard. So we are excited to have two great presenters today, Christina Cardenas, who's the Regional Advocacy Manager at the California Center for Public Health Advocacy, and Katie Bishop from the Nutrition Policy Department at Center for Science in the Public Interest. I just wanted to take a few minutes to go over some logistics of the webinar platform. We're using GoToWebinar. And if you have any questions at any point, you can type them in, and I can either answer them by typing a response, or you can press the raise hand icon, which is the little hand button on your dashboard, and you can be unmuted to ask a question verbally. We will have time for questions and answers between each presentation, so after Christina's presentation and after Katie's presentation. We will be recording this call, and we will send a link to the recording to all of the registrants of the call within a week. So if you know someone who'd like to receive the recording, please ask them to register using the webinar link, and we will send them a follow-up with the recording of the call. So I mentioned that today we'll hear from Christina and Katie, as well as our campaign manager, Lilia Smalkova. And here is a recap of using GoToWebinar. If you have any questions, please contact us at foodday@cspinet.org after the call. We'll be hearing from Lilia, Christina, having some questions and answers. Then we'll go to Katie and have some questions and answers as well. Unfortunately, Nancy Hunergarth with the New York State Healthy Eating and Physical Activity Alliance won't be able to join the call today due to some unforeseen circumstances. But we're very confident that you'll receive a wealth of useful information from Christina and Katie. And briefly, I just wanted to talk a little bit about the Food Day Leadership Series and introduce that. So we've launched this series as a way to build the skills and capacity of our organizers. And you'll note that the dates of these webinars fall roughly a month apart. Our first one is today on policy. In April, we'll be covering the topic Building Coalitions. And one of our confirmed speakers for that is Michael Dimock from Roots of Change. On May 15th, we'll be talking about community change and making community change. On June 19th, we'll talk about policy change, and we have Mark Winne as a speaker on that call. And July 17th, we'll be working on making your point to the media. So stay tuned to foodday.org for more information about the Food Day Leadership Series. And we hope you'll join us for these upcoming webinars. You'll be able to find the registration links on the website very soon. And you'll also receive emails letting you know about the upcoming Food Day Leadership Series. So thank you again for joining today. And with that, I will take it over to Christina, who is going to tell us about her experience with advocacy and offer you some practical advice.
Thanks so much, Catherine. I'm just loading up my PowerPoint. Good afternoon, everyone. Catherine, is it uploaded? Do you see that?
We're having some trouble seeing it. It looks like it's, not quite clear. So I'm going to just go ahead and show your slides from my screen, and you can tell me when to switch them.
Sounds great. Catherine, can everyone see that?
We're going to go ahead and show your slides from my screen. It was taking a second to load here. Okay. Now you can go ahead. Just let me know when to change the slides.
Perfect. Good afternoon. My name is Christina Cardenas. I'm a Regional Advocacy Manager with the California Center for Public Health Advocacy. Next slide. Today we're going to be talking about theories and best practices for advocacy. Next slide. The California Center for Public Health Advocacy is a nonprofit organization. We're actually located in both Northern and Southern California. We're located in Baldwin Park, which is 20 miles east of Los Angeles, as well as Davis. We do work specifically on promoting the establishment of public health policy at both the state and local level. Today I'm going to be speaking strictly on local policy work in the city of Baldwin Park. And on this screenshot we see here our organization, next slide, focuses on working with community residents at the local level to improve food and physical activity environments. And our passion for this work really does stem on one very real and important goal of embracing community members where they're at, developing sustainability through advocacy. We have seen too often policies that have been adopted without any form of community engagement. And when the time comes for implementation of that policy, there's either flaws in the policy or there's challenges with implementation of the policy. And these are due to many reasons, and the most focal and primal of those reasons is the lack of community engagement. We are very, very committed to our process of building sustainability. So in this presentation this afternoon, I will be speaking to how we've used practices and tools for community engagement, specifically through training residents, fostering self-efficacy, self-esteem, empowering residents to take ownership of their communities, and helping them develop skills, knowledge, and tools to advocate for positive change above and beyond food and physical activity issues. Some of the challenges we see in many communities is that traditional engagement processes in the city involve local residents through public hearings, mailers, informational community workshops that many times do not get to, the information does not get to many of the residents. Some of the opportunities that we have seen through this work is really changing this traditional approach to a more inclusive approach. The goal of CCPHA's community engagement model is to provide advocates the skills and resources needed to engage and train, design and do, analyze and develop, create and execute, and lastly monitor and sustain. Some of the outcomes we have seen are advocates have changed their food environments, rehabilitated and established parks, built new parks, and created safe environments for cyclists and pedestrians. Next slide. Some of our primal focuses are to educate the larger community, cultivate policymaker champions, build capacity and partner organizations for policy advocacy, recruitment and training of resident advocates to ensure sustainability, and providing technical assistance to support the adoption of local policy. Next slide. Some of the strategies we've employed over the years have been to lay the groundwork for policy advocacy in target communities, enhancing efforts with CBOs, establishing quarterly meetings for advocates, and moving forward with place-based research. We've also been happy and very promising in training teams of advocates through workshops, task forces, creating policy briefs, train-the-trainer sessions, and generating media attention. And lastly, recruiting and expanding advocate numbers through in-depth policy work, creating policy or in-depth needs-based policy packages, hosting community forums, fact sheets, and toolkits for replication across LA County. Next slide. Click again. So using a multi-pronged approach, we realized that in this work, there you go. In this work, there's many layers and players that need to be part of this process. And so we work with policymakers, community leaders, city staff, experts in transportation and healthy retail, local businesses, and community-based partners. Next slide. And just want to share some of the work that we've been able to delve in here locally in the city of Baldwin Park and surrounding San Gabriel Valley cities is working on nutrition standards for city buildings, parks, and programs, baby-friendly hospitals. We've worked a lot with general plans through health and wellness elements, breastfeeding accommodations, complete streets policy adoption. We've worked a lot on the healthy retail environment through drive-through moratoriums on fast food restaurants, tobacco retail license, smoke-free multifamily housing, and lastly, we've worked in the school arena on safe routes to school and park master plan processes. Next slide. And one of the key aspects of the work that we've developed has been to develop partnerships with both traditional and non-traditional partners. When we first came to Baldwin Park, our organization, we quickly decided to work with partners that already have healthy and positive relationships with the community. Some of those groups included school districts, the Mexican American Opportunity Fund, the LA County Department of Public Health, hospitals, American Heart, Lung, and Cancer, and of course working locally with city departments, including policymakers. We work closely with departments, the Department of Parks and Recreation, city planning, community development, and the city manager. And some of the non-traditional partners that we've worked with most recently have been with 0 to 5 organizations, including CalSafe, Women's Club, Little Leagues, and parent advocate groups such as MAUF, NELEO, and the Local Government Commission. Next slide. And in this work, I know we have really come into Baldwin Park and we've looked at how do we meet our advocates? How do we meet, what's the best forum to meet the community where they're at? So some of the events we attended when we first came to the city were attending community events such as health fairs, city council meetings, community forums, and concerts in the park. We also met residents through introductions by partner organizations such as preschool and child care organizations, other CBOs such as Kaiser Permanente, Educational Outreach Department, and community leaders that have been actively involved already in the school district. Next slide. I'm going to talk to you a little bit about a specific program that we implemented called Change Starts With Me. It's an advocacy program that allowed us to really discuss and analyze the theory of advocacy with residents, the knowledge of civic structure, how to speak on behalf of an issue, and how to develop leadership skills. Some of the activities that we did with graduates from Change Starts With Me was to testify at city council meetings, perform community audits, speak to other community residents, and meet with policymakers. Right? Change Starts With Me was a 6-week course, 90 minutes per session. And what we did is we really started with bringing community members into a safe space where they could discuss what is health, using data to describe their neighborhoods, identifying problems, addressing them and solving them, determining who the policymakers were, advocating for change, and participating in the future. This is a crucial component to our community advocacy model because developing capacity within residents locally has really proved to create more of an investment in their sustaining the policy campaigns that they were involved in. When residents are connected to plan and physical changes in their community, they're more likely to become valuable partners in the adoption and implementation of those changes. As a collaborative, we really sought to create a strong foundation with with community-based organizations here in Baldwin Park. We established the People on the Move Collaborative. Someone put their phone on mute.
Sorry, Christina, I think we're getting some feedback there. Let's try again.
Okay.
All right, that's fine.
Okay, perfect. I don't know. That was interesting. So just wanted to share that the People on the Move Collaborative, we established the People on the Move Collaborative in the fall of 2004, and it was a name that was adopted. The name was given by the community to represent the collaborative that was funded to implement Healthy Eating Active Communities. Healthy Eating Active Communities was funded by the California Endowment with the goal of improving food and physical activity environments for school-age children. The goal of the initiative was to build on our existing collaborative roots in the community to expand community-wide efforts to improve food environments. And it really, through this process, through the Healthy Eating Active Communities process, it really allowed us to move from community educational workshops to more self-sustained community engagement models. Next slide. Our collaborative included community members and youth. That's, I guess, one of the first changes that we made in our collaborative structure was to really bring community members to the table during the development of our work plan in those initial stages of campaign development. It allowed us to bring community members into contact with various sectors and to invest and develop long-term resident and youth engagement. Community representation at our meetings helped us to develop stronger community-based mechanisms for implementing funding, developing systems change, policy adoption, and cross-sector collaboration. Some of our partners included the city, the school district, organizations working on tobacco cessation, local hospitals including Kaiser and Citrus Valley Health Partners. Next slide. One of the things that we did as a collaborative is to really look at what are all the pieces to the puzzle that are required in really supporting community to advance local concerns and policy development. Some of the pieces that we included in needing to, as a collaborative, cultivate was research, community mobilization, partnership building, policymaker education, media advocacy, expert panel advice, and state and local data development. Next slide. And through this process, we developed some strategies, which I'm going to speak to now, specifically through a couple of case studies on effective community engagement. The first thing that we focused on was to really be clear about the purpose and goals of community engagement and the community to be engaged. We really shared with the community members the funding parameters and whether funding supports community engagement. We also learned a lot about the community. We learned through community forums, who do residents identify as decision makers, allies, and opponents. And the one thing that we learned was that the community really saw the city as not as an ally, but really as through the process that they had used in gathering resident input, they really felt like they were an afterthought. They thought that the process that had been used thus far was not inclusive of all community members, of all languages, and so we really kind of thought to, as in working specifically with the city, to kind of change the community perception of their partnership with city processes. Next slide. So the first case study I'm going to share is the Baldwin Park Healthy Corner Store program that we launched. We started off with a corner store marketing audit. So upon completion of Change Starts With Me, resident advocates were trained to conduct community assessments of local corner stores. Youth and residents equipped with cameras and paper surveys mapped out corner stores, 17 of them, within a 2-mile radius of schools. Community members assessed various aspects of the stores, including the marketing aspects, signage, produce placement, and cash register findings, store products, types, quality, and quantity, and lastly, alcohol and tobacco placement. The 17 stores were selected by community residents following a community discussion on healthy food access. It was one of the main community concerns following safety and school attainment. Parents were concerned about what their children were eating on their way to and from school. Next slide. Community data has allowed residents to use photographs and other evaluation tools to assess the conditions and problems from their perspective to define for themselves what works and needs to be changed. So here's a photo of youth and residents in a local 7-Eleven that captured basically kind of findings of what they saw as being offered, at point of sale, throughout the store, marketing. And here's a particular quote from a youth who says, "As a student, I feel that it's important to observe and investigate what children and teens my age are being sold in liquor stores. There are better foods and selections out there, and that should be available to us." So using these photos and using these assessments, we developed a healthy corner store report. Next slide. And if you see here in this photo, we have a few residents that are standing outside of a corner store with clipboards who conducted the assessments and surveys. The surveys and assessments basically kind of showed us what we all know in terms of product placement and what we find in communities where there's very, very low access to produce, very easy access to products high in sugar, fat, and salt. Next slide. We also find it very, very crucial to commit to the long-term involvement. So through this process, we developed a Healthy Corner Store Task Force. The Healthy Corner Store Task Force compiled the data that was collected from the surveys and developed a report and presented this report to City Council, asking for the City Council to develop a healthy retail task force. They invited council to serve on the task force and were able to secure one council member to serve alongside with them as part of the Healthy Corner Store Task Force. Next slide. Through the report, we're able to prioritize what the community saw in their seek for searching for healthy food. We learned that community members and youth wanted to see real change in their retail environments. We learned that business owners did not have the support or resources in business management to determine customer needs and innovative marketing strategies. We also learned that through our collaborative partners that resources such as Healthy Floor Guidelines, WIC, and business incentive loans were not known by the owners or the participants. So with that, we developed a Healthy Selection Corner Store program, which featured customized visits with store owners, store owner interviews, and ongoing customer surveys. Next slide. The program was implemented in 3 phases. On the right, you'll see a photo of a logo, Healthy Selection. It was a logo that was designed by one of our youth that participated in the program, one of our high school seniors. And the logo was used as collateral. It was used in stores for displaying products lower in fat, sugar, and salt. Phase 1 of the program allowed us to bring these logos, to bring bags, grocery bags, into stores to increase healthy marketing, product placement, and resources for healthy retail to stores. Phase 2 allowed us to really cement our relationship with the city to develop Healthy Selection City Recognition campaign, So what we did is we worked with the city to recognize participating stores, which ended up being 14 pilot stores in total. And the city was able to provide them with free advertising in the city paper, in local events such as the concerts in the park, and it even visited their stores to provide them with a certificate from the city to display in their stores. The phase 3 of the project was to complete a partial to complete corner store conversion. And here is an example of conversion and policy development. And here in this next slide is a photo of one of the additional partners that we worked with, which was Smart and Final. So we not only worked with small corner stores, but we worked with big box chains such as Smart and Final to really kind of, when they were coming into the city, work with them to look at their floor plans and develop, identify and inform them that the city and the community members were interested in kind of ensuring that there's these healthy produce displays at the cash register and throughout the store. Next slide. And here are some photos of some of the program accomplishments. Some of the partnerships with Champions for Change included healthy food demos in the produce areas. We work with stores to improve refrigeration and lighting in produce areas, as well as signage, as you'll see in the photo on the right. We also worked with City Council, including the mayor and key champion City Council members, to provide recognition to the stores. And as I mentioned, we've assisted stores with ensuring that there is plenty of collateral in their stores to identify that store as a community partner of healthy selection. Next slide. And the last aspect of the next case study I wanted to share with you is the Baldwin Park Complete Streets policy. We use the exact same community engagement model where we trained residents to be part of a Smart Streets task force. They received customized trainings on transportation, what is a complete street. We developed Smart Streets focus groups for a design fair, and we work closely with the local government commission and the city to develop a comprehensive opportunity for community members to gather at a safe community setting, which is a community center, to look at maps to really kind of prioritize major corridors of concern and develop recommendations for the improvement of mobility, transit for all users, walkability, bike lanes. And we had over 500 residents participate and drive the charge for the adoption of a complete streets policy in August of 2011. We hosted a total of 5 community workshops from June to September, and we hosted them at school sites. I think one of the key things that we've learned through this process is that meeting community members where they're at locations where they have built trust and relationships already are crucial. So meeting residents at school sites proved to be very effective in this complete street community charrette process. We met at 5 school locations with over 250 residents, and the workshops provided insight into the safety, transportation, and infrastructure concerns of residents in Baldwin Park. Next slide. The process involves conducting an evaluation of meetings where no group weighed more than the other groups. We use the same format for every meeting and collecting small group data with a note taker, discussion sheet, map of the city, and one presenter. At the end, core members met to review the collective findings and compare them to long-term solutions to walkability and safety. Next slide. So here's just a photo of just a specific map that was utilized and the process that was utilized. The woman that's standing in the blue is one of the trained residents who went through the Change Starts With Me program and was trained in table facilitation, which really we felt having resident-to-resident-led facilitation was crucial and ensured trust, more confidence, more comfort on the community's part. And we also ensured that a city representative, whether it be fire, planning, parks and recs, was also present at each table. Next slide. So some of the outcomes were transportation and infrastructure recommendations. As I mentioned, the implementation of a complete streets policy, an implementation plan related to greenways and aesthetics related to the master plan, an increase in inspections of lights found to be in disrepair, incorporating safety measures for pedestrians such as crosswalks, stop signs into the public works master plan, and lastly, supporting the creation of a health element to the Baldwin Park general plan. So many, many things came out of this workshop series. The workshop series allowed for youth and residents to assess barriers to walking and bicycling along corridors, as well as discuss opportunities for growth to addressing physical changes to the problem. We felt that the workshops and walkability audits offered an opportunity for friendly and informal discussions among community members, school staff, public officials, community-based organizations, and technical experts to develop a citywide vision and workable solutions for improving walking, biking, and motor vehicle safety. The outcome of the entire process was that advocates were trained to assess issues at hand, and it really led to the city council, city planning departments to really recognize that community engagement from the inception, rather than community engagement during just a community input opportunity at council meetings, was more productive and more fulfilling. The mayor himself, if you see a photo on the right here, listed health as one of the pillars for a sustainable community amongst safety, infrastructure, fiscal responsibility, and the future. Baldwin Park really has led the charge in kind of leading from the top. The mayor himself, council members actively participated in all community engagement workshops, really made it clear that this is something that they prioritized and endorsed. The Complete Streets Task Force that was created following the adoption of the Complete Streets policy to ensure that the policy itself would have community engagement as part of implementation, as an implementation arm of the policy itself. So the city has really been nationally recognized for its incorporation of health in all policies, and as I said, creating health as a fifth pillar in its guiding pillars. Next slide. And some of the outcomes of grassroots advocacy we have seen have been resident champions that have been at the table for now over 7 years, who, as we mentioned, they sit on these task forces and have made kind of really close personal relationships with city council members, planning department, community development leads, and have been able to kind of bridge and really change their original perspective of city processes to really feel included in the process. We've also been able to advocate or work closely with teen advocate leaders who have led the charge in, which we didn't talk too much on this presentation, but have really led the charge on school-based change. We've developed multiple best practices for additional surrounding cities, including La Puente, El Monte, Bell Gardens, South El Monte. We've also developed an advocacy curriculum that I'm going to share shortly, where you can find some of the toolkit, some of the pieces that we've used over the years. And it's really led to the ability to work with our partners on seeking additional funding in other arenas based on the community engagement structure that has been used in our funding. And one of the great highlights of this effort has been we received in the fall of last year a visit from White House chef Sam Katz, who visited the Healthy Selection stores in Baldwin Park and was able to not only speak to the store owners, but speak to the resident ambassadors that have conducted weekly store visits to those stores to ensure that the program has been implemented, and has also led us to really kind of reach out to surrounding communities but in convenings such as Mark Winne Thomas to really speak to other community engagement structures and processes in other surrounding cities. Next slide.
Christina, I'm sorry to interrupt, but we actually are going to have to wrap up. We have a few questions, and I want to make sure we have time to get to Katie's presentation. But we had a few technical difficulties along the way, so we're running a little behind.
Yeah, I think that's the last one.
Okay, so I will go then just one question, and then we can show the resources slide. So quickly, one question from Leslie Henry is, are there any downsides to having well-trained and well-prepared citizens meet with lawmakers to lobby? For example, do some politicians react better to what they perceive as, sincere pleas from constituents? And is how best to approach a specific lawmaker part of your training program?
Yeah, I think definitely one of the things I can definitely speak to most recently is the residents having, grown in their savviness to really kind of look at, not just food and physical activity issues, but really look at kind of issues, local issues. They've embraced additional issues that, aren't part of our funding, but they're, they've gained confidence in their voice and their ability to go to council meetings and to speak during public comments. So we've had residents that most recently have spoken up against the city's currently deciding to bring the sheriff into to take over and kind of disband the police department and bring the sheriff to take over. So residents have attended council meetings and they've spoken, and so some of the, I wouldn't say challenges, but some of the growth that's resulted as this process is residents are speaking up on issues that they wouldn't have spoken up on in the past. And what we do is, with policymakers that either come to us and say, what are the, are your residents representing the entire group? Are they speaking for themselves? What our response is that, residents are entitled to speak during public comments. That's their right as citizens, and that's something that, it's not something that we. That's something that's exactly what we've been teaching them in this process, is that they need to be inclusive and be allowed to use their voice in these public opportunities. And so I guess that came to the top of my head for that specific question. But I think for the most part, the local leadership here in Baldwin Park and surrounding cities really do understand that the tools and resources that they have gained through this process are not something that we have, that is strictly an outcome of this process, but it's something that they themselves, when they meet together, when they learn and establish alliances together, they have developed on their own, and they've been able to embrace it on their own and utilize it. So I don't think it's been that much of a challenge, aside from, controversial issues that need to be spoken about.
Great, thank you. And so for everyone who has been asking about the PowerPoint, we will make this available so you'll be able to see this resources slide. And for Melanie Bourgeois and a few others who had questions for Christina, if you can stick around to the end of the call, we'll take another Q&A session at the end and try to get to your questions. So now we're going to move to Katie Bishop, who's our Nutrition Policy Associate at CSPI, and she's going to talk to us about policy and advocacy. So go ahead, Katie.
Hello, everyone. So like Catherine mentioned, I'm going to talk to you about policy and advocacy. I'm coming from the nutrition perspective, so I'm going to talk a little bit about, why we want to influence nutrition policy. So as we all know, obesity rates are soaring, and so are chronic disease rates. And so we want to help support people's efforts to eat well, be active, and achieve a healthy weight. So this obviously involves personal responsibility, but there are other areas where we can use policy to help make more supportive environments so people can eat better and be active. And these include education, so letting people know which foods they should be eating, how much physical activity they should be getting, having supportive policies in our workplaces, in our schools, in our states, in our towns, and then also making environmental changes, and this can be done through policy. So ensuring that people have access to affordable, healthy foods in their communities, and they have places to be active. And when we have all of these things together, then people can eat well and they can be more active. So advocacy is needed at multiple levels, obviously at governmental levels like the federal government, state governments, and local governments. And if you are doing advocacy to government officials, you're going to be talking to legislators like members of Congress, state legislators, your city or town council members and their staff. But you can also talk to people in the executive branch, like people in governor's offices, mayor's offices, your state Department of Agriculture, your town board of health. There are lots of different ways that you can do advocacy with government officials. But then there are also other decision makers that you can do advocacy with, such as in work sites or schools or your healthcare providers. There are lots of different ways to do advocacy and affect policy changes that aren't necessarily within government. And advocacy is a core function of public health. And as health professionals, you're very influential constituents. So you might be a nutrition expert or a food safety expert or an agricultural expert, or you're just really passionate about those issues. But you're also a constituent, which means that you're a voter. So you're a very important voice to be heard by decision makers. And if you're worried about getting into advocacy, you have to remember that very few advocates are trained in advocacy. They just sort of learn as they go. And remember that advocacy is very similar to education. So really what you're doing is you're going in and you're trying to educate these decision makers about something that you're passionate about. And also remember that if you're worried about trying to influence policy and not really knowing much about how policy is passed, then that's okay, because the staffers that you're talking to and the legislators you're talking to know the policy process. So you just need to know about the topic you're talking to them about. So when you're getting started in advocacy, you need to think about a few different things. So first off, what is your issue going to be? If you're thinking about nutrition, it's a really broad topic. So you need to narrow that down. Are you worried about the food in schools? Are you worried about food marketing to kids? What is your specific topic going to be? And then you should figure out what goal you want. So do you want a specific bill to be passed? Do you want a healthy meeting policy in your work site? What's your end goal? And then you can figure out who to target your advocacy efforts. Are you targeting state legislators? Are you targeting your local school board to get that end goal? And then what are your methods going to be? Are you going to have sit-down meetings? Are you going to use multiple different methods? Are you going to have a letter writing campaign? And then also you need to identify your allies. So there are obvious allies, like the people that are interested in the same areas as you, but then you might be able to find additional allies. So if you're trying to change the foods served in an after-school program and you're coming from a nutrition background, you'll have your nutrition advocates. Then you also could include parent groups who would be very interested in that topic as well. And advocates have many different tools. So you could use letters or emails, phone calls, in-person meetings. You could have fact sheets that you can leave with the decision maker. You could present testimony at a committee hearing. You could do interviews on your local radio station. So there are lots of different tools that advocates can use to bring attention to their issue. And when you're developing those materials, you want to think about how you can be concise and how you can be persuasive. So think about what your issue is and what your key points are that you're going to make. And you want to try to limit those key messages to about 3 messages, because the decision maker might not have time to read through that whole material, or it might not be something that they're initially interested in. So you want to make sure that you grab their attention right away. And you want to use stories and examples that are really make the issue important to them. So if you're talking to a state legislator, you want to include examples from their district. Or if you're talking to somebody in a work site, you want to include stories from the employees. and use numbers and really tangible things so you can show the decision maker how many people will be affected by this, how they'll be able to improve the lives of the people that they care about. And you also want to make sure that you have a specific ask for the decision maker. So you want them to vote in favor of a bill. You want them to write a letter of support to the governor. You want them to implement a healthy vending policy. You have to tell them what you want them to do to help improve this situation. And you want to make sure that you're really prepared for the meeting. You need to do your research. You need to know what the issue is. You need to think about what types of questions are going to be asked to you so that you'll be able to have a response for them. If you do know where the decision maker stands on the issue, that's great. Or if you can think about where they might be coming from, so you can think about what aspects are going to be particularly important to them and be able to address those issues in your fact sheet or your meeting. You want to make sure that you organize your thoughts so that you're really hitting the key points that you think are going to be persuasive. And you want to practice what you're going to say so that you don't get fumbled over the words that you're saying. And you want to make sure that you're very concise. The people that you're talking to tend to be very busy people, so you want to make sure that you can make a very persuasive argument in a little amount of time. And one final thing that I want to mention as you're moving into the advocacy area, one of the coalitions that we coordinate at CSPI is the National Alliance for Nutrition and Activity. So if you are interested in nutrition and activity advocacy, this is a great organization to get involved with. We're a coalition of 350 national, state, and local organizations. It's a very diverse membership. At the national level, we have groups like the National Parent Teachers Association, the American Cancer Society. Then we have groups that are smaller, like county boards of health, all the way down to small public health organizations. And this is a great way to keep in touch with advocacy efforts that are going on with nutrition and physical activity across the country. We send out a lot of resources like talking points and fact sheets, so it can be a really great way to get involved in advocacy. And if you're interested in that coalition, the website is up there, www.nanacoalition.org. It's free to join, and it's a really great organization. And finally, I just want to wish you good luck in your advocacy. I'm not going to have time for questions, but feel free to send me an email if you have a question about anything I said. And just to give you a brief explanation of what I do at CSPI, I work on the Healthier Food Choices for Public Places initiative, which is basically using food and nutrition standards to ensure that healthy options are available in public places like state parks, hospitals, universities, workplaces, highway rest stops, agency buildings. So if you're interested in that topic, feel free to check out our website or send me an email.
Thank you so much, Katie. We appreciate you being on the call. If anyone has questions for Katie, you can email her or type them in the question box, and we'll save those for her to get back to you later. So now we'll go back to one other question for Christina, and then we'll go on to Lilia to talk a little bit more about the leadership series. One person had asked the corner store marketing audit that Christina mentioned. What kind of reaction did you get from store owners? How did you get them on board? Tobacco, alcohol, and junk are the main money makers for many small corner stores.
So I think just first off, so in kind of talking to the corner store owners, the first thing that we noticed with many of the stores is there were some cultural differences. For instance, Korean-owned stores, and their ability to communicate with their customers. So for the most part, we had a positive response from the owners. First of all, they had to give us permission to do the surveys. So we did have 2 stores decline being part of the process and being part of the survey process. So for the most part, because they gave us their consent in advance, they actually were looking forward to the responses, because many of them, as I mentioned, who either had cultural barriers with the community members that they served, they actually wanted to know, what patrons in their stores said about the quality of their produce, what they wanted to see in terms of produce, and patrons were even given the opportunity to speak to the sanitation, what do they observe about the store. So I think for the store owners, they each received a store profile, so basically told them what patrons buy at their store, what they buy from other stores, what they would like to see. So a lot of them took it as a, a gift, because it's something that being able to do that research on your own time, especially when you're the only one working in the store, for them it was a valuable resource to really make changes and kind of bring specialty items, bring things to the stores that customers in fact wanted to see.
Great. And any more questions from the audience for Christina and her presentation? You can either type them into the dashboard here or press the raise hand button and I can try to unmute you. Someone had asked about the multi-pronged approach slide, and we will be sending the slides to all the registrants by email, so you'll be able to look at those again. But now I think we're going to move on and just talk a little bit about the Food Day Leadership Series in general and mention those dates again. Thank you, Christina, for your presentation and for answering those questions. And for those of you who do have additional questions, you can type them in and we'll save those and try to get back to you by email. So Lilia, are you there?
Yes, Catherine.
Okay. I'll try to go back to the slide and we can talk a little bit more about the Food Day Leadership Series.
So thank you everyone for joining, and we hope that you found the presentations useful, and we would be happy to have your suggestions on what other topics you would like to hear. Our idea is to have the leadership series every month, and in the next weeks we'll talk about how to measure the community change, how to build coalitions, how to create networks. We will have a webinar with Michael Dimock from Roots of Change next month. Save the date, Wednesday, April 17th at 2 p.m. Eastern Time and 11 a.m. Pacific Time, about bringing partners to the table to change the state food system. And Michael will talk about an amazing work that Roots of Change doing in California to improve the food system, working with cities and with their policymakers and how they created the coalition. And we hope that these ideas will help the Food Day Network to plan for October 24th, but mostly to get engaged throughout the year in advocacy, in promoting the projects that people who got involved with Food Day are working on, to go beyond just one day of action, but creating a network and learning from each other. So please send us any feedback you have on this series, because we really hope to make it as useful as possible, and suggestions for future topics. So thank you, and Catherine, I pass it to you to wrap up.
Great, thanks. And to those of you who didn't get your questions answered, please do type them in now, and we will get back to you by email as soon as we can. And for all of the registrants on the call today, we'll send around notes, the recording link, and the slide deck so that you can use those in the future. So thanks again for joining, and good luck with your advocacy efforts. Be in touch with us to learn how you can get involved in Food Day. Thanks.